Also this hour, do you have ME or chronic fatigue syndrome? I'd like to hear from you. In the news today, the health watchdog NICE is no longer recommending a therapy that encourages people with ME to gradually increase physical activity. As you will know if you have ME, it's called graded exercise therapy. As The Guardian reports, charities and patient groups have been fighting for greater recognition of the condition as a medical illness rather than a psychological problem. Graded exercise therapy involves incremental increases in physical activity to gradually build up tolerance. Patient groups have argued that its use suggests those with ME have symptoms due to inactivity. We will hear from NICE in a moment. But if you have ME, this affects you, you'll know much more about this than me. Please get in touch. How much do you struggle to have your condition recognised? How much of a problem was even diagnosis? I know from conversations I've had with people who have ME that it can take many months of suffering symptoms, sometimes years, for a diagnosis. And even once that comes, there's a question of it being taken seriously and treated. So tell me, please, what ME is like for you, how it is regarded by the medical people you deal with. And what do you have to say about graded exercise therapy? 0345 6060 973. You can text 84850 and tweet at LBC. Dr Paul Chrisp is the director of the Centre for Guidance at NICE, the body which has just removed gradual exercise therapy from the ME treatment guidelines. Doctor, welcome. How are you?
I'm good. Hi, Eddie.
Tell me a little about your thinking here at NICE.
This has been a guideline that it's taken us about 3 years to produce, with 31 committee meetings with our panel of experts and patients, people who've got lived experience of ME. So it's important that we listened to their experiences and balance that with the evidence and come out with guidelines that we hope will improve the consistency in practice, give them better outcomes and a better care experience, and also just improve their access to care. Now, you mentioned graded exercise therapy, and it's really important that we're clear here what exactly we mean. And you trailed this in your introduction. What we're talking about is exercise therapy that's defined by precise increments of exercise, rather than having a person-centred approach to exercise and activity management, which is what we hear that people with ME really want.
Can you, just explain for people who don't have ME what the difference is between those two things?
Sure. So ME affects about 250,000 people in the UK, and it really varies widely. Some people have got mild symptoms, some severe symptoms, and are quite disabled by it. So obviously, if you've got that variance, there isn't really a one-size-fits-all approach. So therefore, personalised management really is important. People need to work with their specialist teams and figure out what sort of activity and energy management works best for them in how they manage their symptoms and to help them recover. So the graded exercise therapy, what we mean in the guideline, is very fixed increment of exercise, going up with these fixed levels between time spent being physically active. And that's what we're saying doesn't work for people with ME as we define it. So that's people who've got what we call post-exertional malaise. So if you try to do too much, you get too tired. So there is a role for exercise management. That's a message we really do want to make clear, but it's got to be in consultation and managed by the patient in consultation with a specialist team to make sure it's right for them and within what they can actually manage without making their symptoms worse.
So more personalised than one size fits all?
Yeah, that's right.
Clearly, this has taken a great deal of work, and as you say, consultation with people who have ME. Why was graded exercise therapy adopted in the first place?
So I think it seemed to have a place based on some research evidence, and our guideline, our first guideline was produced in 2007, and we felt it was long overdue. to review the evidence and to review people's experience with that. We have heard from people with ME that they felt that there was harm being caused by it. So it was important for us to pause and to have a look at our guidance, review the evidence again, review the diagnoses of ME. And that's really important. It comes back to this piece about this post-exertional malaise being a key feature. And looking at the evidence through that lens and listening to people with ME and saying, okay, what do we think we should recommend here as a way forward to make sure that people get the care and the services that they deserve.
What was the harm that some people reported?
The harms that we've picked up on are that people felt that they pushed through what they felt they were capable of doing, and therefore it made their symptoms worse. It made them relapse. So again, if you think about this term, this post-exertional malaise, that means that you feel tired after you've done something. If you do too much, it can really knock you back. So if you're on a program that you feel takes you beyond what you're capable of, it's perhaps no surprise that some people felt that their symptoms got a lot worse.
Doctor, thanks so much for talking to us. That's Dr Paul Chrisp, Director of the Centre for Guideline at NICE. Over to you if you have ME, and particularly, of course, if you've used gradual exercise therapy. It was good to hear from the doctor there, an explanation that, well, certainly I could understand. If you have ME, you'll know more about this than I do. And hopefully all of us, including everyone who doesn't have ME, are now a bit clearer on this and what this change means. Alison has ME, and Alison, you tried gradual exercise therapy. How was it?
So I had graded exercise therapy 30 years ago, right at the beginning when it was first being recommended.
Oh, you were the pioneer.
I was one of the pioneers, and I was one of the first people to be devastatingly harmed by it.
Goodness, what happened?
So it started well, but I was told that I needed to find a sustainable baseline, which is good and would come under activity management, so I'm not doing far too much on my good days and nothing on my bad days. So we mapped out what I could do every day for 2 weeks. We took it right back down to what I could do on my worst days, and I was only allowed to do that every day. And then I had to pick 3 activities to gradually increase, and each week I was asked to increase those activities, regardless of my symptoms, and to push through. So I did those 3 activities at the expense of anything else. I wasn't allowed to do other things. I wasn't allowed to do anything I couldn't repeat every day. I was asked to increase every week. And to start with, I appeared to make a bit of improvement because I started way below what I could manage. So on those 3 activities, I was improving, but I wasn't doing other things I'd been doing before. And then I hit a wall and I relapsed a few weeks in. So we kind of cut back slightly, and then I was told to push on again. And I started to relapse more and more as time went on. I was doing this with one of the leading experts in the country in an NHS clinic, exactly how it was being advised on the NHS with all the supervision in place very gradually. But I repeatedly hit a wall, and I got to the point where I collapsed so badly I was taken into hospital.
This change in guidance, what do you think of it? 30 years too late for you, perhaps?
30 years too late for me, and a lot too late for a lot of people. Thousands and thousands have been harmed in the last 30 years, and it's very sad. But it is such a relief. I've been in tears today, waiting for this for so long.
What do we now know about ME that we didn't know 30 years ago? And also, more pertinently, I think, how is it regarded by people in the medical profession compared to 30 years ago?
Sadly, in a lot of places it hasn't changed. A lot of medics are very ignorant about it, and people are not getting the care they need. A lot of people are being told by their GPs, go out and exercise. A lot of people are being given graded exercise therapy in supposedly specialist clinics, and all the research in recent years has shown that exercise is dangerous for ME. Making people with ME exercise is like giving sugar to diabetics. It's like telling someone with a broken leg to go out running before the broken leg is mended. It's exactly the opposite to what they need. You need whatever activity you can manage within your limitations, but not to be pushing through symptoms, because that is dangerous. And it's not just that you get tired when you push through, you collapse. My legs stopped working, my gut stopped working, my heart stopped working properly. Every system of your body is affected. You don't just feel tired, you feel like you're dying.
And today, besides crying tears of joy, how are you?
I'm still severely ill with ME, 30 years later. I've never been able to work enough to support myself. I've had periods of being able to do very part-time study, a few hours work a week at my best for 2 hours, for two years. But then I would get another virus and relapse again. And I believe that being told to push through near the beginning permanently damaged my health.
It's good to see you. Thank you for talking to us. We appreciate it. That's Alison's experience. What about you? Let me know what ME is like, not least because of what Alison was saying about her experience of still coming across blocks in the medical profession who don't get what ME is. We're talking this hour about new advice today from the health watchdog NICE, no longer recommending a therapy that encourages people with ME to gradually increase physical activity. Lisa is in Barnet. Hi, Lisa. Tell me about you.
Hi. Good afternoon.
Hi.
I was finally diagnosed with ME, coming up for around 20 years now. And it's something that I live with still on a daily basis. Some days, I can go for quite a few days, even a week of it, thinking, loads of energy, feel great. And then, back to where we were. Not as chronic as I was, I'll be honest. I had my time when the kids were really young. I was 6 months in bed, couldn't move, couldn't pick them up from school, couldn't take them to school. Husband had to literally cut my food up. And the battle has been, often being dismissed as being, overweight, lazy, that kind of attitude from, various people in the profession. It's certainly, something like graded exercise definitely would not have worked for me 100%.
And when you say you were finally diagnosed 20 years ago, how difficult was that?
It was really difficult because I actually even changed my GP. I was falling asleep at the wheel of my car, sort of parked up. I was just, it's really hard to explain the kind of tiredness it feels. So if you sort of imagine that you've done back-to-back marathons, maybe 3 or 4 times over, you can't, it doesn't matter how much sleep you get, how much rest you get, you just never feel relieved. You never get that sense of, if even now, it's like the brain just doesn't. The
brain's not going to help you. Not going to help you answer the question. Do you feel? No. Do you feel that you want to sleep but can't, or you can't put one leg in front of the other? Or what about? Sorry, I'm asking all sorts of questions. Is it like a brain fog as well in terms of concentration?
There's brain fog, lack of concentration. I used to back in the day be super organised, worked in, high level EA executive positions. All of that stopped. I couldn't function. I couldn't organise. I couldn't cut my food up. I couldn't literally lift the fork to my mouth. And even now, there are days where, I might have gone out for a walk. We were all getting out there walking during the lockdown. And there was an occasion a couple of months ago where literally my husband had to go and get the car. I could not it felt like the plug had been pulled and I could not lift one foot in front of the other. And it's really hard to explain.
And how often did you encounter people in the medical profession, or even family, acquaintances, who, to some extent or another, indicated to you, get a grip, or get some rest, or have a holiday?
Oh, yes. I mean, I remember once being, my friend took me to see see, there you go again. Can't get
It's okay.
Can't get the word.
It's okay.
A professional, let's just say a specialist, who actually, if she hadn't been sitting there, I would have come away not believing that he had said basically to my face, "You need to stop being a couch potato. You need to lose weight, and then you'll feel like you've got your energy back." A neurologist, that's who it was.
Oh, right.
I was absolutely shocked. And, at my worst, I literally could not get out of bed. At my best, I've been able to undertake some art, which was really, really good therapy for me, and it got me out of the house. My friend would pick me up. She would take me to the art group. And gradually, as I got better and stronger, I was able to take myself. Now, sort of 20 years in this journey, I know when I'm about to have an episode where I really can't do anything but just lay down on the bed.
Lisa, thank you for explaining all of that to me. And lots of texts and tweets on this. Let me just get through some of them. Kerry says, ME for me is being shut in solitary confinement in a dark room requiring tube feeding for 20 years. All the talk about exercise and rehabilitation is for the birds for me. I'm seriously sick. We have no treatment. Another tweet. ME was triggered by cancer treatment. It's been 5 years. I'm still managing with it. Graded exercise has helped, but not on its own. I benefit a lot more by doing CBT and OT therapies and managing activity through that. Bill says, I've had ME for 15 years. Graded exercise therapy was suggested to me in the early days when I was told I was deconditioned. Just weeks before, I was training for my 3rd London Marathon in a row, so I wouldn't have said deconditioned. Our energy production system is broken, not our willpower. Another tweet, I was diagnosed with ME at 12. Eventually, after being told by a GP I was lazy and needed to get off my backside, I went through GET and it made me significantly worse. I was repeatedly made to do more than I felt I could. It was like torture. I was in such pain. And Rachel says, I've been ill with ME for about 15 years. It's destroyed my life. Whilst my GP and most medical professionals I've seen are sympathetic, they can offer no cure or even treatment. Over the years, I've tried repeatedly to increase my exercise, but every time I relapse within 48 hours and can be floored for days with worsened symptoms. Rachel, I'm sorry to hear that. I'm glad we've managed to take a little time to talk about not just ME, but graded exercise therapy today. Thanks if you took the trouble to get in touch.